Hello, today we will see what is mechanical ventilation and its modes. A mechanical ventilation is a treatment to help a person's breath. A ventilator is a machine which pushes airflow into the patient's lungs to help them breathe. Now, the mechanical ventilation can be divided into two. They are non-invasive ventilation and invasive ventilation. The non-invasive ventilation or the NIV is performed by keeping a tight mask on a patient's face. It tightly covers the nose and the mouth. It is connected to the ventilator. It can also use at home by people with respiratory difficulties. Now let us see the type of NIV or non-invasive ventilation, that is CPAP, APAP and BiPAP. The CPAP is nothing but continuous positive airway pressure. In CPAP, it delivers a constant and steady airway pressure. In CPAP, the patient receives constant and steady airway pressure. Next one is APAP, that is auto-titrating adjustable positive airway pressure. So in this, it changes the airway pressure according to the breathing pattern of the patient. So in this APAP, the airway pressure will be vary according to the breathing pattern of the patient. So last one is BiPAP, that is bilevel positive airway pressure. It delivers air with different pressure for inhalation and exhalation. In this BiPAP, we can set different pressure for inhalation and exhalation. Now let us see invasive ventilation. Invasive ventilation is performed by keeping a tube into the trachea. The invasive ventilation can be divided into two, that is endotracheal and tracheostomy. In endotracheal intubation, a tube, that is an endotracheal tube, which is inserted into a patient's airway or trachea through the mouth or nose. And in tracheostomy, a tube is inserted through a hole which is made into the airway. It is mostly done for the patient who requires long-term ventilation, or sometimes if the patient have any abnormalities in the mouth or face, mostly they will go for tracheostomy. In invasive ventilation, we have four modes, that is control, assist control, SIMV and PSV. In control, assist control and SIMV, we have subtypes. They are pressure control, volume control and PRVC. Before explaining these modes and subtypes, I'll explain some settings and the parameters which is necessary for the ventilator. Now let us see the settings of ventilator. The first one is tidal volume. Tidal volume is the volume of air that the client receives with each breath. Now rate. Rate is nothing but the respiratory rate, the number of breath or the ventilator breath delivered per minute. In 1 minute, how many breath the patient has to take. Now the fraction of inspired oxygen or the FiO2. The FiO2 is the oxygen concentration which is delivered to the client. It is determined by the patient's condition and the ABG status. Next one is peak airway inspiratory pressure. This is the pressure needed by the ventilator to deliver a set amount of tidal volume at a given compliance. So this is nothing but a pressure which is required by the ventilator to deliver the set tidal volume. The last one is positive end expiratory pressure or PEEP. This is nothing but the positive pressure is exerted during the expiratory phase of ventilation. This is a certain amount of pressure which will be remaining in the alveoli after the expiration. So this will enhance the gas exchange and prevent the atelectasis. Atelectasis is nothing but the collapse of the alveoli. There will be some pressure will remain in the alveoli and the alveoli will not collapse. So this is called as positive end expiratory pressure. Now let us see the modes of ventilator briefly. We have four main modes for ventilation, that is control mode, assist control, SIMV or synchronized intermittent mandatory ventilation. Last one is the PSV, pressure support ventilation. Now first one is controlled ventilation. In controlled ventilation, the client receives a set of tidal volume at a set rate. The respiration is completely controlled by the ventilation and it will not allow the patient to breathe. In this mode, the patient should be paralyzed and patient should not breathe. It is mainly used for the patient who cannot initiate respiratory effort. The second one is assist control. In assist control mode, we have preset tidal volume and rate as in the control ventilation. Now, here the ventilator will respond to client's inspiratory effort. It delivers a preset tidal volume when the client initiates a breath and allowing the patient to control the rate. So what is the difference between controlled ventilation and assist control? In these two modes, we have preset tidal volume and a set rate. But in controlled ventilation, the patient should not breathe. The respiration is completely controlled by the ventilation. In assist control, if the patient is responding or if the patient has the inspiratory effort, the ventilator is allow him to breathe. The ventilator allow the patient to initiate a breath and it deliver preset tidal volume. If the patient does not have an inspiratory effort, it will act as controlled ventilation. Next we have SIMV, Synchronized Intermittent Mandatory Ventilation. In this, there will be preset tidal volume and respiratory rate. And in this mode, the ventilator allow the client to breathe spontaneously at their own rate and tidal volume. In between, the ventilator breathe to reach the preset rate and tidal volume. So what will happen in SIME? In this case, the ventilator allow the patient to take his own breath and the ventilator will support in between. And if the patient is not reaching the preset tidal volume and the preset rate, the ventilator will help the patient to reach the preset rate and tidal volume. The last one is pressure support ventilation or PSV. In this, there is an application of positive pressure on the inspiration that eases the workload of breathing. The patient should breathe spontaneously and the patient should capable of breathe on his own. Here, the machine help to continue and end the cycle with the pressure. So in PSV, the ventilator only gives the positive pressure. There will not be any preset rate and tidal volume. So the patient should breathe on his own. Now, in each of these three modes, we have subtypes. They are pressure control ventilation, volume control ventilation and PRVC. So the first type is pressure control ventilation. In this pressure control ventilation, the pressure is constant and the volume changes according to the patient's complaints. In pressure control ventilation, we will set the pressure in the ventilator and the volume, the tidal volume will change according to the patient complaints. Next one is volume control ventilation. In this, the volume is constant. So in the ventilator, we can set the volume and the pressure varies according to the lung compliance of the patient. Now we have PRVC or pressure regulated volume control. As the name indicates, here we have a preset tidal volume. In this, the pressure will vary to maintain possible airway pressure throughout the cycle according to the airway compliance with a set amount of volume. So in this PRVC, we have a set tidal volume. And to maintain this tidal volume, the ventilator will maintain a minimum possible airway pressure. This is called as PRVC. I hope you understand this video. If you like the video, please like, share and comment. Also subscribe my channel and don't forget to press the bell button. Thank you.